Hey everyone, Dr. Chris here with Sports Chiropractic, and today we want to talk to you about something you can do at home in case you have like a history of any type of disc injury for the low back. And this can be called the McKenzie Protocol. McKenzie Protocol is a way to kind of take the jelly that's kind of leaked out of a disc and kind of push it back to the middle. And there's three variations I want to show you. You can do one standing or sitting. There's a laying down version, and there's one if the disc goes out to the side a little bit too to try and get that back into place. So the standing version is easy. All you're going to do is try to stand up, make sure you're completely erect. Now, when you have a disc injury, most of the time you also don't want to go into flexion, meaning lean forward. That's usually a big enemy for you. So this nice is easy. Take your hands on your hips, lean back as far as you can or to the part where you start to feel pain. And once you hit that point, just go back to normal. Slow and controlled. You don't have to hold it for any amount of time. And just slowly go back and then come back to neutral. And that's the standing. Now you can do the same thing sitting in case it's difficult to move up and down if you have an acute disc injury. Second version that we're going to show you is sometimes if you ever have an MRI, it'll say the disc is off to the right a little bit or off to the left a little bit. And that is one of the reasons why you get the nerve root that hits and disc hits the nerve and it goes all the way down your leg. So say if you have a problem on the right side, whatever side the disc goes to, that's what side you want away from a wall. So this version, lean against the wall, put your hand on your hip, and try to lean against the wall, again, as far as you can until you start to feel pain, and then come back like this. And again, go against the wall, and then come back out. And again, this is if the disc is off to a side, but you need an MRI to kind of confirm that. Third version, on the ground, and this is actually the best way to do it, and this is for the normal ones that go to the back. All you're gonna do is lay on the ground. And if you're familiar with yoga, a lot of people call this the cobra pose. So all you do is lay down on the ground, and then try to flex your lumbar, the low back, push up with your hands, and arch your back up again as high as you can. Now, there's one part of your hip, a little bony part of the hip at the front, that's the kind of pivot point you want. So you lift up as high as you can, and if that starts to come off the ground, that's all you need to go to. And then you come back down flat. Now, keep your hips on the ground, your legs on the ground, your feet, you don't need to lift those at all. And all you're gonna do is lift, come up as high as you can, and then come back down. And when you come down, try to actually decompress and relax at the bottom in between reps. So a good protocol for this. You want to try and do it in sets of 10, three times a day. More doesn't necessarily mean better. And again, if you're doing it, one of the things to do, if you're doing this and at any point your pain actually gets worse while you're doing it, cease immediately. You don't want to do it. That means it's actually potentially making your disc injury worse. But most patients, while you're doing it, first repetition, you should feel some pain. By second, third, fourth repetition, it should get less, and less. And that's an easy thing you can do to work on your disc if you're at home.